Hi, I'm Dr. Pari. I will never forget January 15th, 1990. I came home from school, pranced into my house, went into the bathroom, pulled down my white Guess jeans, and I saw brown spots. I was mortified. I thought I myself. The reason for this misconception, because in actuality I had started my period, was because I was growing up in Texas, which we all know really isn't the mecca of women's sexual health and reproduction education. And my mom had had a hysterectomy at the age of 34, so there weren't really any feminine products in the house. I was completely confused. Obviously, my mom found the gene, she gave me a talk, and she told me I was becoming a woman. Oh, how great. It's interesting because I was 10 at the time, but as a gynecologist, now I'm an expert in periods, and I realize that women of all ages are confused still about what is a normal period. It's literally the #1 question I get. So I'm gonna go over what constitutes a normal period so that you can know. So the first thing is to know that the first day of your menstrual cycle is considered day 1. A normal cycle length, meaning going on to the next period, can be anywhere from 21 to 35 days. This is commonly very misunderstood. People always come to me and they're like, oh my gosh, I have my period every 3 weeks. Well, as you can see, 3 weeks equals 21 days, totally normal. Another thing that you need to know is how long is a normal period? Well, a normal period can last anywhere from 3 to 7 days. The average days is 5. But if you're too short or too long, you need to see a doctor. One of the things, though, that this doesn't apply to is if you're on hormonal birth control. Hormonal birth control can sometimes shorten the length of your cycle, or you may not have a cycle at all, and that is completely normal. So another thing to look out for is that if you're having any sort of spotting in between periods, this is always abnormal. Also, if you have spotting or bleeding with intercourse, if you have spotting or bleeding with exercise, heavy lifting, you need to see a doctor. Another thing to go over is the amount of blood. How much is normal? I mean, it seems too heavy. Is it too heavy? How do I know? How many pads? Well, technically it's 80 milliliters, but I mean, I don't know anybody who's gonna go holding a measuring cup up there. So basically, if you think it's too heavy, then you should talk to your doctor, especially if you're missing school, missing work, or you're getting dizzy. These are reasons. Another reason is if you're missing school or work because of pain of your periods. It's totally normal to have painful premenstrual symptoms in the few days leading up to your period, even a week for some people, and then during your menses. But if this is something that is not relieved by Advil or over-the-counter pain medications, you need to see a doctor. Could there be something else that could be going on? So that's a little 411 on normal periods. If you have any questions or comments, please leave them in the comment section and I'll be sure to get to them. Thanks.